We have breaking news. The Department of Health and Human Services says gender-affirming care poses a risk to children's health and well-being. HHS Secretary Kennedy just introduced what the department calls actions to protect children from harmful medical interventions.
The American Medical Association, the American Academy of Pediatrics, peddled the lie that chemical and surgical sex-rejecting procedures could be good for children who suffer from gender dysphoria. They betrayed the estimated 300,000 American youth ages 13 to 17, conditioned to believe that sex can be changed. They betrayed their Hippocratic oath to do no harm. So-called gender-affirming care has inflicted lasting physical and psychological damage on vulnerable young people. This is not medicine, it is malpractice. We're done with junk science driven by ideological pursuits, not the well-being of children.
Last month, the department finalized a report on gender-affirming care for youth, claiming it found, quote, medical dangers posed to children. The report alleges that gender-affirming care, including puberty blockers, cross-sex hormones, and gender-affirming surgeries, caused significant long-term damage. Now, the House has passed a bill that would criminalize gender transition treatments such as surgery and hormones for minors. Let's bring in University of California, San Francisco professor emeritus of psychiatry, Dr. Dan Karasic, for more on this. Dr. Karasic, thank you for coming on. The Academy of Pediatrics hasn't responded yet to this announcement, but in reaction to a May report on this topic, they said, and I'm quoting here, that the report misrepresents the current medical consensus and fails to reflect the realities of pediatric care. So what's your reaction to the Health Secretary's announcement today?
So the HHS report, frankly, would make George Orwell blush. It is a compendium of disinformation that dismisses decades of experience working with trans youth, all of the research supporting those efforts, and replaces that with authors who are all part of organizations that are dedicated to ending care for transgender people. In doing so, they are asking parents to disregard their experience with their own adolescent children, the work that those youth have done with therapists, with their doctors. These are people who may be engaged in care, may already be on hormones, may have already transitioned, and the Trump administration is putting these families in the middle of the culture war and ripping away their health care with nothing to replace it. And I think it's unconscionable and it's doing great harm.
Secretary Kennedy says these gender transition treatments are neither safe nor effective for children, and that there's an overwhelming body of evidence that these procedures hurt rather than help kids. What's your response to that?
That's a lie. There is enormous amount of evidence. The HHS document itself mischaracterizes and dismisses that evidence and substitutes it with innuendo, with references to op-eds, to references to lawsuits, to references to podcasts of people opposed to transgender care. It's really a disgrace. And then, this was constructed clearly as a basis of fulfilling a campaign promise to end care to trans youth. And so this whole document is a rationalization for it. But it has no basis in reality. And I could go on for days with all the lies, really, that are there.
And Doctor, I'm out of time, but quickly, the House has now voted to criminalize gender transition treatments for minors, like surgery or hormones. That still would have to pass the Senate and so on. But what would it mean for doctors and patients if that were to become law?
Well, doctors would stop providing that care and would still have their careers and be able to work taking care of cisgender youth, but the trans youth and their families would be the ones hurt. There already families have had to move from states that have banned care to states that still allow it, and now every family I know has a contingency plan of moving abroad or going abroad to get care or finding ways to get care still in the United States. And it's been tremendously stressful. The Trevor Project had a study showing a dramatic increase in suicide attempts in the states that have banned gender-affirming care. And I'm very worried for the well-being of trans youth who are having their care ripped away.
All right, Dr. Dan Karasic, we appreciate your time today. Thank you.
Thank you.